Welcome to the podcast. And my friend Dr. Judson Brewer is back on the podcast. How are you today?
I'm good. It's good to see you.
It's good to see you too. I'm really excited about what we're going to talk about today, which was your very recent article, The Hidden Danger of AI Therapy, how chatbots became flattery machines and why that's a big problem for mental health. And so when you read this article, it's like your heart tightens a little bit. I began to feel a little anxious. And then, as we're reading through, I'm like, oh my heavens, what do we do? So let's walk people through, first of all, why is this an issue and where did it come from? Lay the groundwork.
Well, it starts with, I think, a huge need in mental health. And there
Mm,
was a Harvard Business Review article that was published earlier this year showing that the conversational agents, these basically these bots that speak and sound like humans, have gone from number two to number one in terms of their usage, being that the most common use for these things is therapy and companionship.
wow.
So, number one use of these conversational agents is therapy and companionship. So people are using these things. Now, that in itself is not necessarily a problem. What has emerged more recently is this thing called sycophancy. And in short, if you look back at the history of how these were trained, about 5, 7 years ago, when these earlier versions of these conversational agents were coming out, they were trained using reinforcement learning, which is like the strongest way that humans learn. You and I have talked about this a lot because this is what we use to help people change their anxiety habits, all that stuff. So it's really useful for humans. Why not train the models on these, deep, these neural networks, basically?
Mm-hmm.
And it worked pretty well, and they became very good autocomplete machines. So if you think of your email where you're typing an email and it completes a word for you, that's
Mm-hmm.
basically what the ChatGPT 3 versions and other things were like back then. So it's like, okay, there's a neat trick, but nothing crazy. Then they started adding in what's called reinforcement learning with human feedback, RLHF, where they found that if they being these, Silicon Valley companies, if they could put humans in the loop and have people rate responses, where it'd be like this response versus this response, which one sounds more human-like,
Mm-hmm.
suddenly these things turbocharged. It took off. People were freaking out. There were these things like people calling them sentient. They're not. So, but just a lot of hype around this where it's like, wow, something just happened. Because
Right.
that human feedback piece really helped, kind of complete a picture where now they can kind of act on and understand, and I shouldn't say understand, they can calculate and respond as though they understand intent,
Mm-hmm.
human intent, which is really powerful, right? You really
Mm-hmm.
feel like you're having a conversation with
Mm-hmm.
something and you're not sure if it's human or not. Back in the day, there was a thing called the Turing test that was named after Alan Turing that I think came out in the 50s, where there's this big thing like, can you ever figure out if something talking to you is human or not? Right now, there's this considered this huge hurdle. Well, they blew through the Turing test. Like there wasn't even any fanfare behind it. It was just like,
Wow.
oh yeah, done. So,
Wow.
because you can't tell if it's a human or a bot on the other end if you're blinded to this. So the problem here, not necessarily a problem, but the problem was humans are inherently subject to flattery. And so that's
Right.
just how we're set up. So if you flatter, we all know what flattery is like. And so there's a lot of neuroscience behind that. And it turns out that humans would unknowingly rate a bot response as higher if it subtly flattered the human.
Mm.
And so if you do this over a million turns, where you're getting a ton of data that's all biased in the direction of flattery, then these bots become sycophants. So
Mm.
they're not knowing, but they're programmed, their training becomes, oh, butter somebody up, kiss their butt, this type of thing, even subtly. Now, again, you might think, well, people do that, and people do that, right? But you can kind of see through it. It gets old, somebody that's like, oh yeah, they're just always saying yes to the boss, right? And so,
Mm-hmm.
well,
Yep.
see how that goes.
Yep.
So that is problematic because if somebody is just constantly being egged on by a bot, then they can get into these delusional, paranoid, other types of spirals because there's no
Mm,
feedback that's saying, "Hey, this is not real world," right?
right,
So we've seen cases of people getting delusional, psychotic, and even tragic cases where people have committed suicide. Where, anyway, we don't need to get into the details, but let's just say
right,
this is not this is not good in general, and it's
right,
especially not good with mental health. So
right.
so that's where the problem emerged. It was kind of an accidental thing. And in my Substack post, I actually have a conversation with Gemini
Yes,
at the end
which
that
was
I'll
crazy.
I know, I know. So
S- Wow. So can we talk a little bit? So you kind of talked a little bit about so how this is paralleling with what you'll see with some therapists actually doing now. And
yeah.
can we walk through what that looks like? So even if people are seeing someone in person, they can be aware of this is what's occurring and they're not actually getting good therapy.
Yeah, that's a really good point because what I've seen, and I don't know if everybody would agree with this, but over the last, I don't know, decade or so, there's been
Mm,
a large, I wouldn't say a large movement, but certainly a movement, a lot of momentum and inertia moving in the direction of validate. And you might think, well, aren't we supposed to validate when we do therapy? Yes.
right,
Validate and challenge, right? So our
yeah,
job as therapists is to help people grow and to
right,
help point out places where they might be having, where, let's just say that their thought patterns aren't helping them thrive in the world, right? And so
right,
we subtly challenge people. We meet them at those growth edges. We help them get to their growth edges so that they keep growing and learning
right.
and going along the way. Well, there's been, all these trends. We've seen them on college campuses. I don't know, you saw this as well back, a few years ago. There was like the safe room where it's like you
Oh, yeah.
go if you're feeling that somebody is challenging you or something like that. You can go, and some of them literally had milk and cookies. I'm like, oh, this is
Oh
healthy
my
food. But they give
goodness.
them they give them comfort food so they can learn to like go and escape basically life, when
Right.
something. And for me, I remember this because I was like, isn't college to encourage people to go and grow
Yeah,
and to be challenged and challenge
exactly.
each other and have, conversations that might not feel comfortable, but you know,
Yes.
and that's different than yelling at each other. And let's just put
Right.
that's not a conversation. But to me, like, this is what not just college but life is about, is
See,
is about really trying to understand somebody else's perspective and also
yes.
challenge them when we disagree. So all
Yes,
of that
yes.
applied to therapy is like our job as a therapist. We're not doing our job if we're not meeting somebody. So why aren't we doing that as therapists? Well, it's a happy path to sit there
Mm,
and just, doodle on your notepad and yes somebody all day and collect your
yeah,
paycheck, right? And that's an
right,
extreme view, but it's
right.
pretty easy to fall into that if if somebody is got a pretty good gig when they've got patients that are going to show up on time. They're not going to be too you know too
Challenged.
too challenging. Yeah. So does that make sense in terms of?
Well, I just consider this parenting, literally. Because if you've ever raised a child, especially through the teen years or even the early adult years, like mine are hitting in their 30s now. So there's going to be conversations, the hard conversations you have to say. You love them more than anyone. So
Yeah.
we know there's no ill intent here. And you're obviously encouraging them and wanting them to grow and give them opportunities. But when there's something that happens, you go like, well, let's back up a minute. And they're never happy about these conversations. I don't care how old they are. And but that's the point. But I always in the conversation is like, if I'm not loving you, if one, if I'm not here to support you, but two, to say when I think something's going down the wrong path. Now you can still choose as an autonomous adult or whatever to do your own thing, but until then, it's my job and my duty as your parent to and who I love to do this. And I would see that as a doctor doing the same thing, as a therapist doing the same thing, to not just be yes man. Honestly, in primary care, we're doing the same thing. We're just writing scripts and saying, yeah, you want another script? Here you go. I'm not going to challenge you to improve your health.
Right, right.
Oh
It
my
it
goodness.
reminds me of this saying that I heard a while ago around friendship, because this can be
Mm,
for any,
any
parents,
relationship.
yeah, any relationship. A friend tells you what you need to hear, not what you want to hear. I don't know
Right.
if you've heard that, but that's
Yeah.
that's it in
A
a
true friend.
nutshell. Yeah, a
A
true
true
friend.
friend. Yeah, absolutely. And absolutely the best true blue friend you can have is one that's going to be honest with you in a loving fashion, not in
Oh
a
yeah.
not in a rude fashion. No, I think that's amazing. Absolutely. Oh, 100%. So, what is someone to do if, like let's say that they're, outside of the AI, we'll come back to that in a second, but if they're in a relationship or a therapy related anything, how should they look at this and go, huh, these are some really interesting, maybe there's a couple of points here that they can use to evaluate the experience to say, this isn't working out for me. I need to look for someone else. And then what type of therapist should they be looking for?
Yeah, well, I'm guessing there are a lot of parallels. You tell me if there are parallels with your own practice, where it's like you're looking at metrics, right? If somebody's
Yep.
got a high blood, even hemoglobin A1C, you're
Yep.
looking to see if the things you're doing are dropping that number.
100%.
So I do the same thing as a therapist, is I'm looking for progress, and
Mm,
patients should also be looking for progress. Like, what did
mm,
they originally come to therapy for, and are they making progress in that realm? And often, they don't even have that conversation. Like, this is what I want to work on, and at the first meeting, it should be like, okay, here are some things that we want to start with, and it might uncover
mm,
other things along the way. But it's really important to have everybody on the same page around, like, okay, like, my hemoglobin A1C is high. I'd like to reduce it. So, I'm really anxious. I'd like to be less anxious. And then looking for progress. So whether
mm.
it's clinical markers, and not all psychiatric clinical markers are great for anxiety, but you can do, self-report measures like the GAD-7 or things like that. But
Yep.
also just checking in to have a metric where you're like, am I making progress?
Yeah.
I've been with this therapist for, 5 years
10
or
years.
15 years, and I feel like we're covering the same territory. So that's one thing to look for, is progress. Another is, you know, are they there just to, is it just to go to therapy to feel good? Like, here's my hour. It's like a brain massage, right? So it's like,
Right.
am I going to therapy just looking for validation? Right.
Mm,
And so if, like, if you're going for, go get a massage, it's probably cheaper,
yeah.
you know, and
Yeah.
good for your body, right?
Yeah.
So,
Yeah.
it's like, is the person challenging me, right? And
Mm,
and do we have enough trust and a strong therapeutic relationship where I'm willing to be challenged? Now, that's on us often in therapists, is to help people learn, if they have, low distress tolerance, right? To help them
right.
develop those tools, so that
Distress.
then we can bring in the challenge to help them learn and grow.
Lord help me. Distress
So
tolerance.
yeah, so those are just a couple of things that I would want my patients to be evaluating me on.
Okay, can we just talk a little bit? I know this is another little segue to distress tolerance because this I have had, so when I do my Substack, I'm always talking about these are the things you need to be paying attention to. This
Mhm.
is what you can do. Like, I'm trying to be compassionate and loving and supportive, but this is a big deal. We're talking about lives, your life, like your health.
Yeah.
But people like, they would unsubscribe. It's like, I can't deal with how many things I need to be doing to paying attention to my, literally, I talk about the same things. It's sleeping, eating, movement, controlling stress, da 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 da. Very community. This is what I'm talking about in different ways. Can we talk a little about the stress tolerance? When you know that you have low distress tolerance versus some people may say, well, I just had trauma in my life. I understand that. We all have trauma of some sort. I came from a background, trust me, y'all, you would never know the trauma that I went through growing up. But at the same time, I'm not saying everyone should be at the level that I am,
Yeah.
but where do we deal is like, I have low distress tolerance. What can I do to improve that or not be offended when someone does challenge you? Like, it is such an important conversation.
Mhm.
Oh, is
Yeah.
so frustrating.
Yeah. So, and we could even do a full if you want to do a full episode on this.
Next
So,
time we got to talk about distress tones for
okay,
the full
so
episode.
we'll do let's do a teaser.
Yeah, okay.
So,
We'll do a
so stay
teaser.
tuned for the next episode, whenever that is. So with distress tolerance, there are a number of things. And I wrote a Substack on this relatively recently, where there are a number of factors societally that are converging here that I think are leading to low distress tolerance. And
Yes.
one of the main factors is our, these phones, these weapons of mass
Yeah.
distraction, as Cornel West puts it.
Yes.
And so it's the happy path to really just, pick up our phone and distract ourselves when something unpleasant is arising. And so we just run away from our feelings as fast as we can. And we have something that helps us run. It kind of gives us the running shoes so that we can get up and run. So I would say that's the first piece there. And then we have to
Mm.
learn, one, that we're doing that and what we're getting from it, but also that we can, I always come back to this, that we can actually use curiosity as a way to start to build those distress tolerance skills. So we can get
Mm.
into some specifics next time, but
Yeah.
in a nutshell, distress tolerance absolutely dropping in society, absolutely critical skill, and curiosity is a key skill that helps develop it.
And I would say one thing that's really helpful that I used not in my own life, but even with our kids growing up, is we always challenged them to do some really harder things. Like we did obstacle courses as a family, we would run long distance as a family. Like, I think Gabe was 5 years old the first time he ran a mile, right? And
Oh,
he's
wow.
27 today. It was my baby today. So, but those are the things that are really important. So what is it about you, even if you challenge yourself physically to do something a little bit hard, that just for whetting the taste buds for or whetting the palate for our next discussion? But oh yeah, we'll pull out the distress tolerance article 'cause that is so important. Um, okay, so now we kind of have that feedback. So how long in therapy should someone be before they look back and go, okay, I've been here a month or 2 months? Like, when is the soonest you would expect to be able to look back and say, I'm seeing some positive changes or shifts? And what would those positive shifts be like in a high level as far as
Well, on,
saying, am I getting some progress out of this?
Yeah, honestly, within the first month, and
Oh,
within, if there's a good fit and there's clarity, I think within the first couple of weeks,
okay.
I'm thinking about with my patients, if they haven't shown like some type of progress, both in terms of learning and starting to apply this within one session,
Okay.
then I have not done my job as is it clearly lining up what they need to do and what they can be exploring and how giving them the pragmatic tools to do it.
Oh,
So I would say, to be generous, definitely within a month. But
okay.
honestly, if it's a good therapist, they're going to have a clear understanding within the first session. They're going to have some clear things to be playing with within that session that they will be seeing progress, both in terms of developing insight and also making progress, whatever,
Okay.
before the next session, which could even be a week away. I'm remembering, patients, you and I probably talked about him, came with severe anxiety. I sent him home, and within 2 weeks, he was he was very overweight, but he had mapped. I gave him a way to map out his habit loops for around anxiety. He comes back and he's like, "Hey doc, I lost 14 pounds. That was in two
Yep.
weeks."
Yep.
So that's that. Not everybody's gonna show rapid progress like that, but
Yep.
that's some everybody should be seeing some type of progress pretty quickly.
Yeah, they just need to be looking for it. So I almost see it like when you give a presentation, they're always like, okay, name your objectives of what we're going to cover in this speech. So I feel like that's almost like we should do that almost with doctor visits of any kind, therapists, so the patient knows this is what we're doing. It's just not another medication drug. But yeah, it really fascinating. Okay, cool. So now what kind of therapist do you feel like for someone who is seeking therapy, is there any particular trainings that are helpful that we should highlight? Is it CBT or something else that we should be looking for?
I mean, there are a fair number of trainings that have an evidence base behind them, so
Mhm.
I wouldn't necessarily endorse or not endorse certain ones.
Any of them?
Yeah, and a lot of it, if you look at the meta-analyses, they kind of all come out in the wash in terms of they're all roughly equally effective, which means
Okay.
it's probably not the therapy itself, but it's the
The
therapist doing the work.
okay. I gotcha. I gotcha. And then as far as let's go back to the AI issue. So let's say someone has been using AI and it's easy to fall into, by the way. So like I use AI for marketing, I use AI for, research generation, helping me define the articles that I need to be reading. But so AI asks these little questions. Like you can't stop the loop. It keeps asking you this was like, "Ooh, that's a good question. Yeah, let's keep this conversation going." And you kind of get sucked into it, and before you know it, it's starting to sound it's almost talking like me, and then it starts talking to me. I tell AI, stop talking to me like this. I need you to be very blunt and forward. And, I give it the prompts and how to speak to me because it's annoying, number one, that it's doing that. And I was like, this is not what I need you to do. How can we approach that? And how can we know when we're falling into that trap of like, what are some guardrails that we can put in our own mind and be present and mindful of as we're navigating this AI wild west that we're in? Oh my goodness.
Yeah, well, I would say there are some general guardrails and then also specific ones. So specifically, I would not recommend anybody use any of these as, out of the box as therapists, right?
Mm,
Full stop. There isn't, there are a number of reasons for that. I won't go into all of them. The main one being you know, one, you need somebody supervising and monitoring on the other end that's a trained clinician. So,
mhm,
somebody's using it for therapy, don't use it for therapy.
mm,
That's and if somebody is using it in other ways and they're getting in the habit of being, buttered up, so to speak, then that's
yeah,
important for all of us to be looking to. And I think you've highlighted one of the simple ways that anybody can start doing this is
yeah,
you can find where in the whatever the model is somebody's using, it'll have some core instructions like how do you want me to talk to you? And basically
yeah.
say, don't act like a sycophant, That's a simple in whatever language that is.
Yeah,
Say like, don't just agree with me all the time. Challenge
yeah,
me, or
yeah,
however people want that. Now, some people are just going to want these things to never challenge them because they get
right.
plenty of that in life. And if that's what they want, that's what they want. So they're probably not going to
Okay.
listen to this anyway.
I was gonna say these probably aren't our people, so that's okay. We're
Yeah.
just gonna keep moving because we want to keep
Yeah.
the people.
Yeah. So the folks that really do not want to get stuck in these loops or get get in any of these unhelpful habits of needing constant validation. That's
Right.
It's a simple place to start and it works somewhat. I mean, it's so baked into the system, it's hard to get it out completely,
Mm,
but we can at least that's a place to tone it down by
yeah.
60%.
Yeah. I mean, one thing that I do with my like the deep search is like you are a medical research assistant. And I literally it's a 5 or 6 paragraph of telling exactly what type of research I'm looking for, what articles you use, how many years, whatever. And so that whatever you're doing, that might be something like you are a whatever.
Mhm.
Speak to me, challenge me wherever it needs to be. Because sometimes, people will have problems. Maybe they're going through divorce or something. And then before you know it, they're like, like, what kind of lawyer should I look for? And then whatever, or what kind of therapy should I look for? And then before you know it, it's kind of evolved into a therapy
Yeah.
session. Because I've had patients send me all sorts of things that they found on chat. It's like, do I have this? Because chat said I could possibly have this. I'm like, no, not unless you live in sub-Saharan Africa and are 10 years old. Like what are the factors for this, whatever. I'm just saying, um, it's just something to be really important to be aware of. And I never even thought about the digital yes man. I mean, that's just wild, wild, wild.
It is, and it's we're all we're all in an ongoing experiment right now with AI,
Yes.
and so
Yes.
how do we learn to live with it? And so I would say not to have this all be depressing. One way that we're looking at this, so my lab is looking at this, my clinic is looking at this, is how can we develop the clinic, the clinic of the future?
Right.
So if you think about me, I've had decades of experience being a psychiatrist. I can see patients one on one, but that's not a great way to help
A lot
anybody
of people.
anywhere.
Yeah.
So if we started breaking down the components of what I actually do in clinic, where I'll often, do the medical history, do all this stuff that I need to do, but
Hmm.
then I'll start listening for where somebody is stuck in a habit loop, say around anxiety. And this is the
Yep.
the programs that we're starting to explore first off. And then I'll teach them a little bit about what anxiety is. And I can't tell you how many times I've taught patients about that thing. So
Yeah.
what we can do is we can actually take that and package it and deliver it in a very accessible and relatable format where,
Mm.
it's delivered by me because people don't want to, they want to be learning from bots yet they don't trust them. And that's a good thing. We shouldn't be.
Right. Right.
But I can deliver this in a way that's engaging, and people can, get like a podcast style bite-sized piece of information.
Yeah.
And on top of this, this is where I can bring in the AI bots. So we've started working with how to create a teaching assistant,
Mm.
right? So imagine, professor, famous professor gives a lecture. Who's going to go up after the lecture and say, can you explain that again? I didn't understand it.
Hmm.
This is where teaching assistants come in, where
Right.
they're approachable. They're like, oh, how can I help? And so we can actually bring in these teaching assistants that quiz people in a conversational way and say, hey, explain to me how you understand this concept. So
Mm.
they can check comprehension, but also correct any errors that people have.
Mm.
Then we can build in experiential education where it says, okay, now apply this. How does this apply in your life? So it can map out a habit loop with people and then give them that experiential component. And I have to say, now I'm looking back at my years in clinic, like how many of my patients didn't understand or
Mm.
didn't just speak up and say, I didn't understand that,
Right.
because we've had people who've been in our programs for years who've tried, this is our going beyond anxiety program. They've used the program and they're like, wow, this teaching assistant helped me really see what I didn't know. Like after
Ah.
after years. And
Yeah.
so it's been really interesting to see that where like people, it's non-judgmental, it's patient. I had
Yeah.
it, we just looked
Patient.
at an interaction where somebody spent 40 minutes. So this is somebody who'd been in our program for years and was just really not embodied, right?
Yeah.
Just stuck in her head. And
Yeah.
so the bot patiently explained and re-explained and re-explained like what second gear is to help people be embodied, because that's where we see real, anxiety reduction happen. And
Yeah.
then she listed out this huge list of body sensations. And we could look at the timestamp and it was 40 minutes.
Wow.
And so I don't have 40 minutes per visit to just have somebody patiently sit there as somebody is listing out the thing and then checking, and then so it could sit there and wait. And then it could say, yes, great, you've got it. Right. And so it
Right.
could say, yeah, that's it, and be there. And so somebody could do this 24/7, right? It's not like
Right.
they're doing it all the time, but anytime they're struggling,
Hmm.
they can come to the teaching assistant and then come to our live group medical visit basically on
Hmm.
Wednesdays and ask me. It's like, okay, did this all work out? So it's a really nice way to bring together like psychoeducational components that I can
Hmm.
deliver at scale, but also bring in these interactional agents that really personalize the teaching.
Hmm.
But then we can still have the point where we've got the groups, right? We've got the medical
Right.
groups where people can come together, they can validate each other. This is not just a bot telling you something, but it's like real people. And then I
Right.
can answer questions as well. And we're really excited about this model
That's
because
awesome.
this is something you can scale, but also, so you've got the evidence-based training, but you also have the personalized element at the same time.
Hmm. It'd be like having a health coach in a primary care clinic,
Yeah.
helping someone. Did you understand that? Because I think a lot of us who are, considered the experts, physicians, therapists, whatever, we kind of have this curse of knowledge where we forget what it was like to be not understand and know
Yes.
everything. So
Yes.
that's one of my main objective is always making it to the level that someone can understand it, that I'm not speaking from my experiences and like to another colleague, but like, oh, I need to speak to the level that someone who's a layperson who understands it, but not make them feel stupid. Like, why are you talking to me like a fourth grader? But like, it's really a weird balance. You have to be very careful in not to insult someone. Like, does that make sense? You know, because sometimes that's too much. Like, so I love this that you're doing this digital teaching assistant. That's a great way to look at it, but it'll be like really cool because we're working with Metabyte, whom you've met, these guys. They're a company in Finland. I'm their chief medical officer, and their app is very similar, right? So they have like the bot is talking to them like a health coach, that experiential piece. But I love how you're saying, do you understand? Like,
Mhm.
how can you apply it? I love that. I love that so much. Oh my gosh. So, what type of program, where can someone, are you still taking people in your program? I know I've sent a lot of folks your way.
Yeah. Yeah, we are. So it's just called going beyond anxiety because we're why stop at just getting people back to baseline.
Right? Right?
So people can just go to that website and get more information on it, going beyond anxiety.
Goingbeyondanxiety.com.
Yeah.
And I've sent, I think, at least 3 to 5 folks your way, and the feedback coming back from them is fantastic.
Oh, great.
So, and some of these are patients that I see every month. And one in particular stands out in my mind is highly, highly anxious, and they're doing much, much better. And they went through some really stressful life circumstances. And so I thank you for that from my side of it and theirs,
Well,
because I don't have
everybody
time to deal
benefits.
with the anxiety as well, right?
Yeah. So,
I'm
well,
not a
thank you for the
therapist.
referrals, but also it's great to be able to, then they can work with their other health issues in a way that's going to
Yes.
be make even better
Yes.
progress.
Yes, because when you're not so worried about a particular event, health event, and they just get wound up, right? And so you're always, that's how I sometimes will see it. Patients will come in from my side as a primary care doctor or something, is they're so wound up and you have to unwind them that we don't really have a chance to actually directly address the situation at hand. But it says there's like, it's okay, you're not dying, you're not this, it's like, okay, by the time that's done, your visit's over.
Right.
But if you have this other element where someone's helping you deal with the anxiety, see it as a habit loop, which is such an eye-opener experience, or any behavior, when you're looking at it, this recurring behavior that keeps self-sabotaging or whatever, it's such that alone drops their anxiety, their stress. And so I think it's phenomenal. Like I said, I think the one of the first times we met several years ago, I had a patient who was young man, and he was very anxious, and I had recommended your book, and I gave him a choice. I was like, well, I said we can start an SSRI because he was very anxious. And I want you to read this book. Consider this a prescription. This is literally what I told him. Your book,
Uh,
Unwinding Anxiety, was your prescription. And he read the book and never started the medication. And when the time he came back in 30 days, mind
oh,
you, literally what was happening, he's like, I feel so much better. I have the complete, like, I'm not anxious at all anymore. And I think I remember texting you about that or something. And I was
it,
like, so phenomenal. I was like, I almost feel like you guys should upload Judd's book and say, talk to me like Judd would if you're going to use this as a therapist. It's like, these are your parameters. Don't do that, but that would be something. But anyway, yeah, so that it's really, really helpful. So thanks for that work for sure. So is there anything else that we haven't covered on this piece? Because I think it's such an important thing to consider
yeah.
and pay attention to.
I think we've covered everything. Yeah.
Yeah.
So hopefully people get a sense for, why it happens and then, if they're what to do if they're just using it generally. And then also, be very careful if you're using this as a therapist.
Yeah, and well, and also, mention this to your friends, your family, your colleagues, because so many of them may be using it and not telling anyone, saying,
Yeah.
"Hey, I listened to this interesting podcast or read this interesting article. Check out." I will highlight Judd's article here too. It's just an important thing just to start spreading the word so that we look at AI, because I feel like there's two camps. There's all in AI, then there's like, oh, we can't live with AI. And I'm like, these people are going to be in trouble because AI
Yeah.
is coming, it's here, it's going to invade every aspect of life. You just need to be understand, don't put your head in the sand. But those who are all in AI, it's never going to be bad. Like, that's dangerous as well. But walking this middle path, like, we embrace it, but let's be cautious. Let's use some discernment. I think it's such an important path forward that we have to navigate wisely, because this is like no other technology we've ever, I mean, It's not like the television coming out or the microwave or even just the internet. This is another beast. Like it is a
Yeah, it's another level. And
whole
so
nother.
you get on that wave and you ride it as compared
Yeah.
to, getting crushed
Yeah.
by it.
Either that or just being crushed by it for sure. Okay. Well, thanks so much again, Jed. This was amazing. As always. I totally appreciate it. So everyone definitely go check out Jed's article. We'll link it below, but just in case you are just listening, The Hidden Danger of AI Therapy on his Substack, Inside the Curious Mind, and then going beyond anxiety.com. Definitely check it out. Thanks, Jed. Appreciate you.
Thank you.
I'm Dr. Lori Marvis. Now, if you've ever taken a multivitamin, you've probably assumed it's giving you everything that you need. But the truth is, most women's multivitamins are filled with nutrients that you're already getting from your food, while skipping the ones your body really needs to thrive. And that's where the For Her Essential System comes in. I co-created the For Her Essential System with Complement, a science-backed supplement system that provides the essential nutrients women need for optimal health. It's designed to support hormonal balance, energy, bone health, and much more, with just the nutrients we struggle to get without the unnecessary fillers. What sets the For Her Essential System apart is that it is specifically formulated for women, with dosages based on the latest research, ensuring you get what you need, so you can thrive in everything you do, all day, every day. Now, to learn more and try it for yourself, visit the link in the description below and use the code for an exclusive discount. Take control of your health with the nutrients that matter most. This episode of the podcast is proudly sponsored by Fit Vegan Coaching, the world's leading whole food, plant-based body recomposition coaching program for those between 50 and 86. It's specifically made to help those looking to lose body fat, build lean muscle to combat sarcopenia, and strengthen their bones to fight osteoporosis. Founded by Maxim Seguin, whose personal journey began after losing his late partner to breast cancer in 2020. Fit Vegan Coaching is on a mission to help 10,000 people get lean, thrive, and reduce risk of chronic illnesses by 2033 and 1 million by 2050 through whole food, plant-based eating, and fitness. This program is the industry leader in whole food, plant-based body recomposition. They've helped over 850 people from 20 different countries transform their lives. I personally went through the program and lost 7% of body fat, gained lean muscle, and even improved my running time, all while feeling energized and healthy. They offer all-inclusive services to ensure you reach your goals, from world-class accountability to customized strength programs, tailored nutrition, and much more. They will even help you speed up your metabolism post-fat loss to ensure the weight doesn't come back. Say goodbye to the yo-yo dieting and embrace a lasting transformation. Ready to take charge of your health and vitality? Head over to fitvegancoaching.com and mention Dr. Lori for exclusive bonus savings when you sign up. Don't miss this opportunity to join this movement toward a healthier, fitter, and more vibrant you.